Hello, everybody. Welcome to the Chapter 5 lecture, Medical Terminology. Of course, this chapter is going to go over how medical terminology is made, how medical terms are derived, how they're used, what they mean. Of course, being involved in the profession of medicine, the field of medicine, this is something we're going to have to deal with a lot. You're going to run into medical terminology quite often. I'm sure at this point in your EMT program, you're already well aware that medical terminology is going to play a big role in your ability to function as a provider and also to interact with other providers in the EMTs and paramedics in the field and with nurses and doctors, so on and so forth, in the definitive setting of healthcare. So of course we're going to skip through these introduction slides and jump right into it. So the anatomy of a medical term, how they're made. Medical terms are made of distinct parts that perform specific functions. Changing or deleting any part of the word can change the function or the meaning of the medical term. Components that comprise medical terms include the root word, the prefix, the suffix, and the combining vowels. We're going to talk about these later on in upcoming slides, so we'll keep moving. How the parts of a term are combined determines its meaning. Accurate spelling is essential. Here we don't put as much of an emphasis on it just because we're not really writing medical terms that often, but I distinctly remember in my anatomy and physiology course when I was in my college classes, as I'm sure those of you who have taken the same level anatomy and physiology in college, they used to dock points. I used to get a -1 point for every letter that was out of place for when writing down medical terminology or the spelling of medical terms or even the names of structures in terms of anatomy or the spelling of physiologic processes. In any case, spelling is very important. We're going to talk about later on. You see the root word here in the next bullet point, phasia with an S means speaking or in reference to speech, and phagia with a G means eating or swallowing. So even one letter difference can completely change the essence of what the word is trying to describe. Prefixes, the next bullet point down, you see dys, dis means dysfunction or difficulty. Okay, so we combine the prefix that we're seeing in the third bullet point with the root words that we're seeing in the second bullet point on this slide, and we can put them together. Dysphasia with an S means difficulty speaking, and dysphagia with a G means difficulty eating or swallowing. It's also important to have a working knowledge of anatomy. The next chapter, chapter 6, is anatomy and physiology, so that's really going to be your first plunge into identifying different structures in the body, which is anatomy, and knowing how those structures or organ systems actually work and perform their functions in the body is physiology. So having a working knowledge of anatomy is incredibly important when understanding medical terminology, because a lot of these words put together are going to, a lot of prefixes that we're going to see later on in this chapter and later on in the program are going to be in reference to specific points of anatomy throughout the body. As an example, itis, I-T-I-S, is a very common suffix of a word, which means inflammation subsequent to an infection. And the prefix to itis is describing where the inflammation, where the infection is. So epiglottitis, itis means inflammation subsequent to an infection, and the prefix epiglotti, right, is referring to the epiglottis, which of course is the cartilage covered by smooth muscle flap that sits just above the larynx that contracts while you're swallowing to allow food and water to not pass into the trachea, but to pass over the trachea posteriorly into the esophagus so we can swallow it. So seeing the word epiglottitis, by breaking it down using our knowledge of how medical terms are put together, we know that itis means inflammation because of an infection, and epiglotta in front of it means, of course, in reference to the epiglottis, right? So your knowledge of anatomy is incredibly important in understanding and using medical terminology. and also understand the context of how different words are used. Root words are the main part or stem of a word. It conveys the essential meaning and frequently indicates a body part. Adding or changing a prefix or suffix to change the meaning of a term. Cardiopulmonary breaks down into cardio, which is the root word meaning heart, and pulmon is a root word meaning the lungs, right? So CPR is a abbreviation for cardiopulmonary resuscitation, right? To resuscitate means to bring life back to something or organs or tissues that are no longer receiving blood flow, perfusion, we call that, when oxygenated blood is circulated to the tissues to meet their demands. If perfusion is compromised in some tissue and we enact steps or interventions to restore blood flow to those affected tissues, we call that resuscitation. So putting all three of those together, CPR literally means to restore adequate amounts of blood flow to the heart and lungs. Cardiopulmonary resuscitation. Prefixes appear at the beginning of a word, right? Of course, using our understanding of how words are put together, right? Prefix, the pre in prefix means before, so this is generally the beginning of a word. Usually describes the location or the intensity. Also found in general language, right? A lot of these words that we're used to, that we understand, we don't really think about it too much in terms of the breakdown of a word, right? But if we pick autopilot out of the examples that they give us here on the slide, right? Auto as the prefix means on its own, functions autonomously, right? Submarine, sub means below as a prefix, so again it's describing location. Of course, marine would be in reference to the water, so submarine, of course, we all know means under the water. And cycle means to means some sort of device that moves in a circular motion, right? And tricycle, the tri, as the prefix to tricycle, of course means three, okay? Not all medical terms have prefixes, however, but a lot of them do, so be on the lookout for those as we talk about them later on. Prefixes can also be used to give a root word its specific meaning. If we're using the root word PNEA, which is in reference to air from a Latin derivative, one can add the prefix a. A as a prefix always means without, the absence of, cessation of. Brady as a prefix always means slow, and tachy as a prefix always means fast. So apnea, if we put a as a prefix in front of PNEA, that's apnea, that means the absence of breathing. Bradyapnea would be slow breathing, and tachypnea would be fast breathing. And of course, we use the vital sign ranges for a normal adult that we are getting some practice with in doing vital signs on each other and your friends and family around you. As you start to get practice with that, you start to become really familiar or really comfortable with those vital sign ranges at rest for an adult. So the way that we can classify somebody's rate of respirations or somebody's rate of heart rate, objectively, we use that information to be able to classify it as too slow or too fast. So of course we know by now that a normal adult at rest, we like to say their baseline vitals for breathing should be 12 to 20 breaths per minute. So technically, if somebody was breathing below that threshold at 11 breaths per minute, we could classify that as bradyapnea, which means slow breathing. Or if somebody is on the other end of the spectrum and they're breathing outside of that range but too fast, somebody that's breathing 21 breaths per minute, technically we could say that they are tachypnic, or they have tachypnea, which means, of course, rapid breathing. Some other prefixes that you should be really aware of, two other ones that we use constantly in the medical field are hypo, H-Y-P-O, and hyper, H-Y-P-E-R. Hypo as a prefix, means too low, right, or not enough. And hyper as a prefix means too high or in excess. So when we put those together, say something like tension is usually as a root word referred to as the blood pressure. If we put those prefixes that I just mentioned in conjunction with tension, hypotension would mean too low of a blood pressure, and hypertension would mean too high of a blood pressure. So by learning commonly used prefixes, you can figure out the meaning of unfamiliar terms. So this happens a lot. I still see really advanced medical terminology that I've never seen before, but I use the same approach every single time. Do I know what the prefix is and what it means? Do I know what the root word is and what it means? And most of the time, even if I don't know exactly what that medical term is, I'd have a pretty good guess of what it means just by using the breakdown of commonly used prefixes and commonly used root words to try to figure out what that medical terminology is trying to tell me or what it's used for. Suffixes appear at the ends of words, usually to indicate a procedure, a condition, a disease, or a part of speech. Commonly used suffix, just like we talked about a couple slides ago, itis, I-T-I-S, which means inflammation subsequent to an infection, paired with the prefix arthro, which means joint. So if you put those two together, arthritis means inflammation of the joints, a very common medical issue that most people are aware of. Combining vowels connects root words to suffixes or another root word. Most cases it's an O, may also be an I or an E, used when joining a suffix that begins with a consonant or another root word. Example, gastroenterology, right? Gastro plus entero plus logy means the stomach plus the intestines and the study of. So very plainly, as this breakdown of medical terminology tells us, gastroenterology is the study of the gastrointestinal system, right? And the gastrointestinal system, of course, refers to the digestive system as a whole, comprised of the stomach and the intestines, both small and large. Combining form, a combining vowel shown with a root word. Some common combining forms are cardio, which is the heart, gastro, which is the stomach, hepato, which is the liver. Anytime you see hepa or hepatic, that's always in reference to the liver. That's something important you should keep in the back of your head. Arthro, we already talked about, means joint. Osteo is in reference to the bone. And pulmon, like we talked about, or pulmono, is in reference to the lungs or the pulmonary system. Word building rules. As a summary of the rules, like we've already talked about, the prefix is at the beginning of a term, the suffix is at the end of a term. Use a combining vowel when the suffix begins with a consonant, right? This is used very simply to ease the pronunciation of the word, or a term has more than one root word. If we're talking about plural endings, we're going to apply some different rules. Of course, if you're changing something from singular to plural, it could be something very simple as you see in the first example, from talking about one lung to multiple lungs or both lungs. Words ending in A, we can change to an AE, such as we see vertebra to vertebrae. IS, we can change to ES, like you see diagnosis to diagnoses. EX or IX, we can change at the end of a word to ICES, like apex to apices, or ON or UM, we can change to an A, like ganglion, which is part of a nerve cell or part of a nerve bundle, to ganglia, or ovum to ova, if we're talking about plural or both ovaries. US we can change to an I, like bronchus to bronchi. Prefixes can also indicate numbers, colors, or positions and directions. Numbers. Some prefixes indicate that a term involves a number or two or more parts or sides. Examples include uni, dipple, null, primi, multi, or bi. Colors. Several word roots describe color, such as cyano, or leuco, or ethro, or suro, or melano. Positions and directions. Prefixes can describe a position, direction, or location. Some examples include ab, ad, d, circum, peri, trans, epi, or supra. Common direction, movement, and position terms. Directional terms needed to discuss where an injury is located or how pain radiates to the in the body. Some directional terms include right and left, superior and inferior. Superior means above or closer to the head, and inferior means below or closer to the feet. Lateral and medial. If you were to draw a imaginary line straight down the center of the body, if you're moving in closer to that midline towards the middle of the body, we would call that medial. And if you were to move farther away from the midline of the body, we would call that lateral. Proximal and distal. Proximal and distal are very similar to superior and inferior. However, superior and inferior are generally used to describe the body as a whole on a larger scale. So we would say that the head is superior to the abdomen, or that the pelvis is inferior to the thorax. Proximal and distal mean the same thing. Proximal means closer to the head, and distal means closer to the feet. But we usually use proximal and distal in reference to a specific section of the body, or a structure itself, such as a bone. So we would say, if we were talking about the radius, the bone that runs through your forearm on the thumb side, if we were talking about the end of the radius that is closer to the hand, we would call that the distal aspect of the radius. And if we were talking about the end of the radius that is closer to the elbow, of course that's closer to the head, and we would call that the proximal aspect of the radius. So again, superior and inferior means superior is closer to the head, inferior is closer to the feet. We generally use that to talk about the body on a larger scale. And proximal and distal, again, proximal means closer to the head, distal means closer to the feet, but we generally use those to talk about a specific structure like a bone or a cavity of the body. Really segmenting different parts of the body is when we're going to use proximal and distal. And superficial and deep. Superficial means closer to the surface of the body, such as your skin, and deep means towards the inside of the body. Some other medical terms or directional terms that we can use include ventral and dorsal. These are the older medical terms. Ventral is in reference to towards the front of the body, which would be the mouth and nose, and the chest towards the front. And dorsal would be used to describe towards the back of the body, which would be the spine, the scapulae, and the buttocks would be towards the back of the body. So these are the older directional terms for front and back. The ones that we use now are anterior, which means exactly the same as ventral, the front of the body, and posterior, which is the exact same meaning as dorsal, which is towards the back of the body. Palmar and plantar, and apex is another directional term that we use. Apex is more describing when a structure comes to a point. So if you were to look at a diagram of the heart, you would see the top of the heart is more flat. We would call that the base. I understand that's kind of confusing, The base of the heart is actually anatomically the top of the heart, but base is just in reference to a flat, more smooth portion of an organ, whereas the apex is wherever an organ or tissue comes to a point. So if you're looking at that same diagram, the flat portion of the heart would be the top, that's the base, and you'll see that distally on the heart, on the bottom of the heart, it comes to a point, and we would call that the apex of the heart. Of course, we just talked about superior and inferior. Superior means nearer to the head, inferior means closer to the feet. Again, we use superior and inferior talking about the body on a large scale. Terms to describe the relationship of one structure to another. Okay, so we would say that the knee is superior to the foot and inferior to the pelvis. Lateral and medial, like we talked about, drawing that invisible line straight down the center of the body. The lateral aspect would be towards the away from that midline, okay, and medial would be closer in towards that midline. So we could say that the nose is medial while the ears are lateral, away from that midline of the body. Proximal and distal describe the relationship of any two structures on an extremity. Again, like I said, this is when we compartmentalize the body. We start to break it up into different sections, or we are talking about bones, usually in the extremities, like the humerus or the radius. Proximal means closer to the trunk. Okay. Of course, the trunk being the chest, the abdomen, and the pelvis. And distal would be moving away from the trunk. Okay. As an example, the elbow is distal to the shoulder and proximal to the wrist or the hand. So what they're trying to say is the elbow is farther away from the trunk than the shoulder, but the elbow is closer to the trunk than the wrist and the hand. Superficial means closer to or on the surface of the skin, the outermost part of the body. And deep means farther inside towards the inner body tissues. Okay. Examples include a superficial burn might be a sunburn, which is only the burning of the skin that in a superficial aspect, right? Only the top layer of the skin has been burned. Okay, and we might say that a laceration may be deep, which means that it's cut deeper into the tissue, say with a penetrating trauma, penetrating object such as a knife or maybe a gunshot wound. It's moving in through the surface of the body and penetrating deeper into the body cavity. Ventral refers to the belly side of the body, and of course you can see here the spelling of this word that I already told you about, anterior, okay, which of course means the same as ventral, like we talked about, towards the front of the body, and dorsal refers to the spinal side of the body, the back, and you can see here the spelling for the new directional term we like to use, posterior, which means the same as dorsal, towards the back of the body. And here again you can see more commonly used terms we just talked about, anterior and posterior, which are now replacing ventral and dorsal when we're talking about directional terms. Palmar and plantar. Palmar surface means the front region of the hand. The palm, of course, you have to understand, we're going to talk about in the next lecture. These directional terms are always in reference to somebody's body standing or laying in the anatomic position. The anatomic position is, if you are standing up, it's standing up facing somebody, right? So front first. If you're laying down, it's laying supine, which means on your back. So your front, again, is facing upwards. And with your hands outstretched to your sides, facing forward with your palms facing towards the front of your body. A lot of people stand or walk with the back of your arms facing towards the front of the body, but the anatomic position is, again, when you are standing upright or laying on your back and you have your palms facing towards the front of your body. So when we say palmar, we mean the front of the hand, that is the palm, in reference to the correct anatomic position. And the plantar surface means the bottom of the foot. So the apex or apices that we talked about, apices would be, again, replacing an X with an ES, or excuse me, replacing EX with CES to show plural. It means the tip of a structure, just like we talked about, where the base is a flat portion of a organ, and the apice, or the apex of the organ, is where it comes to a point, the tip. So again, we talked about the apex of the heart is at the bottom, which is the inferior portion of the heart, okay? And where the ventricles come together, the right and left ventricle collectively meets up to that tip of the heart, which we call, again, the apex. So some other movement terms, flexion is, of course, like when you're flexing your bicep. When you flex, you're using muscular contraction to pull your forearm in towards the midline of the body or towards the trunk of the body. An extension would be the opposite of that, using another specific set of muscles to pull your forearm away from the trunk of the body. Adduction, that first term you see with two D's, ADD. Adduction is the motion of an extremity, an entire extremity, towards the midline. So if you were standing with your arm completely stretched out to your side, the process of moving your arm back into a normal position against the side of your body is adduction. Okay, so the way that I remember that in EMT school is if you're starting with your, like we talked about, with your arm fully outstretched to your side, the process of moving it back towards the midline, towards the trunk of the body, you would be adding it to the body, to the rest of the body. So I remember that as adduction. Abduction is motion of an extremity away from the midline. So that would be the opposite process of you starting with your arm flush against your side and then moving it out away from the body until it's completely stretched out, right? And I remember that, of course, as if somebody's being abducted like a alien is picking you up and has a tractor beam on you, taking your arm away from the midline of the body. I know it's kind of stupid, but you can use it if you want to. It helped me to remember the difference between those two terms when I was in EMT school. Other directional terms, bilateral means both sides of the midline. Again, we see that prefix bi, which means two or multiple. So bilateral means on both sides of the midline. You'll see that in further studies, especially when we get into anatomy and physiology in the next lecture, you'll see that the human body is incredibly symmetrical, which means most of the time you have tissues and organs occurring on both sides of that imaginary midline of the body. So we have a bunch of examples. Your ears could be considered bilateral, your eyes, your hands, your feet, your upper extremities as a whole, your lower extremities, even internally on the inside of the body. You have two lungs on either side of the midline. You have two kidneys on either side of the midline. Now, there are a couple things in the body, of course, that are asymmetrical, which are only unilateral, which means only occur on one side of the body, right? And of course, the heart would be an example of that. The appendix would be an example of that, which only occurs in the right lower quadrant of the abdomen. So you can see some very clear examples. Most of the body is bilateral on either side of the midline, but there are some things that are only unilateral, which only occur on one side of the body. The abdominal cavity is divided into 4 equal quadrants. You just heard me mention one. I said that the appendix was in the right lower quadrant. So if you were to take the abdomen, right, excluding the pelvis and excluding the thorax, the chest, if you just took the abdominal cavity and you put a T right through the center of it, like a plus sign, you would have it separated into 4 specific quadrants. And these really help us in the medical field have a quick, easy reference as to where in the abdomen somebody is referencing, say, an injury or somebody's pain or discoloration, whatever the case may be. But it also helps us to memorize which organs are found in which compartments or in which quadrants of the abdominal cavity they actually lie. So, for example, the liver, one of the largest abdominal organs, is found in the right upper quadrant. So, if somebody were to, if some other medical professional were to tell you that you had a patient with pain and bruising in the right upper quadrant of the abdomen, using those directional terms, right upper quadrant, and using those medical terms, right, bruising, discoloration, pain, right, ecchymosis, and contusion, we're going to learn about later on in the program, are also terms to describe bruising. We can use that medical terminology and the directional terms, right upper quadrant, to help us understand or put together with our knowledge of anatomy and physiology and say, if the patient's having pain and bruising in the right upper quadrant, there's a good chance that there was injury to the liver, because we understand that that's where it is inside of the abdomen. So we have the right upper quadrant, the left upper quadrant, right lower quadrant, and left lower quadrant. Learn these concepts to describe the location of any injury or assessment finding. Okay, this is so that medical personnel will know where to look and what to expect. And we do this, for example, it's a lot better rather than saying somebody has a cut on their stomach. It's a lot more beneficial as a medical professional communicating to other medical professionals to say, be more descriptive. The patient has a laceration on the right lower quadrant, or the patient has a laceration to the lateral aspect of the abdomen. And using those directional terms, once you get comfortable with them, every medical professional hopefully is going to be able to know exactly what you're talking about, and it uses a lot more description to more accurately convey that patient's condition, or the injury in this case that the patient has. The anatomic positions, you need to be very comfortable with these different positions. Prone means lying face down, and supine means lying face up. This is going to be very important for our treatment. Say if our patient is unconscious and we need to manage their airway, the mouth and nose, of course it's going to be very difficult for us to assess their breathing, to assess and manage their airway if they are prone, laying face down. So in any case, the only time that our patient under our care should be lying prone is if we find them on scene lying prone. And the first thing we're going to do is roll them supine, right? We're going to teach you how to do that later, but we're going to stop using face down and face up, and we're going to start using terms like prone and supine. So supine is always the go-to position for most patients. So you need to be very comfortable with that. The Fowler position is semi-reclining with the head elevated. So it would be basically just you sitting in a chair. Semi-Fowler is the same as the Fowler position. You're just sitting at a shallower angle, like a 45-degree angle. And a high Fowler's position would be you sitting in a chair at a higher angle, a more steep angle, such as a 90-degree angle. Breaking terms apart, we can use the meaning of parts of a word to decipher the term. Define in this order the suffix, the prefix, and the root word. So we have a couple examples here. Nephropathy, N-E-P-H-R-O-P-A-T-H-Y. Nepher, with the conjoining letter O, and pathy. Pathy means disease. That's a suffix for disease. O, again, is the combining form or the combining letter. And nepher is always in reference to the kidneys. The main functional unit of the kidneys that helps to filter toxins or filter waste products out of the bloodstream to get rid of them are called the nephrons. So NEPH, nepher, is always in reference to the nephrons in the kidneys, or as a whole, just to the kidneys themselves. So nephropathy means the disease of the kidneys. You could also, again, using the knowledge that we already talked about in this lecture, Nephritis would be inflammation subsequent to an infection. Remember that suffix itis, inflammation subsequent to an infection. And again, nepher, meaning kidneys, so nephritis is infection of the kidneys. Dysuria, dys, ur, and ia. Ia means a condition of. Dys, of course, is a prefix we already talked about, means dysfunction or difficulty. And urine, or excuse me, ur is in reference to urine. So dysuria means painful or difficult urination. Hyperemesis. Emesis means, as a root word, vomiting. And hyper, like we already talked about, means too much, too high, or excessive. So hyperemesis means excessive amounts of vomiting. Analgesic, A-N, A-L-G-E-S, and I-C. We can put those together. I-C is the suffix meaning pertaining to. A-N as a prefix means without or the absence of. And A-L-G-E-S, algis, is a root word meaning pain. So you put those specific sections of a word all together to form analgesic, which means pertaining to no pain. You're going to hear this term every once in a while. Analgesics or analgesia is in reference to something that takes away pain. So morphine would be considered a narcotic analgesic, just like an analgesic technique to help relieve pain from an EMT standpoint, because of course we cannot give morphine. We can use chemical cold packs or the application of ice to an injury or a wound, which helps numb the nerve endings and helps slow the relay of those pain signals to the brain. So that could be a non-narcotic analgesic, or we could just call it analgesic technique. Abbreviations, acronyms, and symbols. Shorthand used for communication, developed for speed. Do not trade speed for accuracy. Okay, so limit your use of abbreviations or acronyms to a minimum. Okay, one of the common acronyms that we're going to talk about is DCAP BTLS, DCAP BTLS. And that stands for a bunch of different signs and symptoms that we're looking for when we're assessing a traumatic patient to kind of find or describe the injuries that we're going to be looking for. And that stands for deformities, contusions, which is another word for bruising, abrasions, punctures or penetrations, burns, tenderness, lacerations, and swelling. So you can see that there's a lot of different descriptions. There's a lot of different injuries that are looped in together with DCAP BTLS. So DCAP BTLS should never be used to minimize the amount of things that we're looking for, but it can be used, like we said, developed for speed, to very quickly put those into an acronym to help us remember or recall specifically what we might be assessing a trauma patient for. Abbreviations take the place of words to shorten notes or documentation. Use only accepted ones to avoid confusion or errors, and be familiar with abbreviations in your service area, right? There might be some abbreviations that are used in some county that aren't very commonly used in a different part of the state or in other states across the country. So be familiar with what really is known and acceptable in your service area. And symbols, sometimes used as a shorthand. Use only accepted symbols to avoid confusion or errors. We're not really going to teach you. This is more for documentation purposes. Of course, really, the primary patient caregiver is going to be responsible for documentation. And here in Arizona, that would be the paramedic if you were riding with one. So really, paramedics are responsible for the most part with documentation. So we're not going to get too much use with symbols or abbreviations. But we will see quite a few acronyms to help us study, or to help you, like I said, recall some of the specific things we might be assessing of a patient. But we're not going to utilize these too much throughout the course of your program. What we're really concerned about is that you start to understand and feel comfortable with medical terminology that you will use quite often. And I hope that this lecture has helped you a little bit moving forward in terms of deciphering, or understanding medical terminology. So we're not going to go through the review questions after this. I hope that this lecture helped you, like I said, and I hope that you guys keep studying hard.